So how is the organization for dermatology care? How is the system in Congo? Where does the patient go first? Is there a primary care physician? How is the referral system in Congo?
Yeah, the majority of patients in DRC will see the general doctors. For those who are informed about skin conditions and who are in touch with dermatologists, will be able to tell the patient where to consult to see a dermatologist. Unfortunately, the way they are few, it is still challenging many doctors where they cannot have access to dermatologists, so they will still handle the conditions themselves.
So do you have plans to advocate or to lobby for enlargement for dermatology care in DRC, to create positions for dermatologists, to create training for dermatologists? What is your plan? What is your set out goal? What's your vision?
Okay, I will wish to work with a university, especially maybe from outside North Kivu or North Kivu, where we could train other dermatologists. Maybe our first intake could happen after 4 years. So that one will allow many people who are not able to come in Uganda or to go to Kinshasa to study dermatology when they are still in North Kivu.
Thank you so much. Those are good qualities of the leadership, Dr. Moise, because a leader trains others, mentors others, and allows for continuity of care.
Yes.
So, telling us that you have plans of starting training for future young dermatologists is actually a good thing.
Yeah, can you imagine Dr. Simon treating more than 3 million people? It's not easy treating them alone, so we need others.
Thank you for interesting yourself in dermatology. So now tell us, you've been at Timbara General Referral Hospital. So this is the only center for dermatology training in Uganda, as we know so far, and the only center for specialized dermatological care in the southwestern Uganda.
Yes.
So tell us, what are the services offered at Mbarara? What does the patient expect when they come to dermatology clinic?
Mbarara Regional Referral Hospital Skin Clinic offers several services. We do clinical consultations. Apart from that, we use lasers. We have the CO2 lasers, which helps to remove swelling on the body like keloids and seborrheic keratosis. And we have the pico laser, which can help for hair removal. It can help for skin rejuvenation. It can still help for stretch marks, tattoos, and other several diseases. We have also a phototherapy machine, which we can use to treat vitiligo. What else, Dr. Simon?
So we use phototherapy, as you said, to treat several conditions. Actually, Dr. Moise will be telling you more about these conditions in his next video. But to take a hint, you can manage vitiligo, you can manage purosea, you can manage pruritus from prurigonodulitis, you can also manage lichen planus.
Psoriasis, yeah.
Thank you. So go ahead, tell us more about the services offered, Dr. Moise, other than laser, other than phototherapy.
Okay.
Do you guys have any form of surgery?
Well, we do surgeries. Cosmetic surgeries, and also we do biopsies for dermatopathology. We do that, and also we still have a microscope in our lab in the department itself, which help us to read the slides and also to know the diagnosis. And we have the CO2 laser, which helps to remove the swelling on the body, keloid, seborrheic keratosis, and other conditions. And we have also the pico laser, which helps to treat dark spots. It helps to rejuvenate the skin, and also it can help for hair removal and other several indications.
So I want us to go to an interesting topic. Your viewers would love to know about this. You recently graduated, want to congratulate you, and we wanted to know more about your study. Tell us about your study. What was your study about? What is interesting about your study? What recommendations do you gain from your study so that you can tell everyone out there from what you said when you completed your master's degree?
I had an interesting topic which was about acne scarring and hyperpigmentation, prevalence, associated factors, and quality of life among patients with acne presenting at Mbarara Regional Referral Hospital.
So what were your findings? What do you want to tell people out there from what you got from
Yes, especially for the problem, I've discovered that patients who present with acne, even at the skin clinic in Mbarara Regional Referral Hospital, often present with complications, scarring and hyperpigmentation, and unfortunately there is scarcity of data among both prevalence and associated factors. Yes, many people have talked about acne vulgaris, but complications, I have never seen a study related to that in Uganda, even in DRC. And also, many patients, once you have those complications, it always affects the quality of life of patients. So I was just saying this is very important to be done so that doctors or clinicians and dermatologists can be able to diagnose and treat these conditions to better the outcome of our patients.
Yeah, so thank you. So other acne, what are the other common conditions that we get to see that bring patients to see a dermatologist?
Yes, other conditions which can bring a patient to a dermatologist are several. In the head, we can have hair loss, or we can still have dandruff, which many people seems to consider normal, yet is not. We can have on the face acne, and also can have seborrheic dermatitis. On the face of patients will happen something like dead skin, which will be appearing after the patient have showered. We can have also swelling like seborrheic keratosis. In the beard, you can have something that we call folliculitis. They are like pimples which can happen in the beard. We have also another disease which is very common. I think it is always found on the neck, which we call acne keloidalis. It is very common, and people can't imagine that they have to see a dermatologist because of that. But for today, they have to consult a dermatologist as they are informed.
Does a dermatologist treat nail disorders?
Yes, a dermatologist can also treat nail disorders. We can have nail color changes,
yes,
which is very common either on the hands or on the feet, toes.